All right, let's get started. Welcome, everyone. I'm Nicole from Swing Care, and I'm looking forward to chatting with our guests today, Dr. Elizabeth Ortiz, Dr. Andrea Chadwick, and Melissa Talwar. So thanks so much for being here. This is actually our most requested webinar topic, so I know people are really looking forward to hearing from all of you. Flares are such a hallmark of fibromyalgia, but they're also, part of what makes it so challenging, not just dealing with the increased pain and other symptoms, but also just not knowing when they're going to come up. So I'm really excited to talk with all of you so we can get some more understanding around fibro flares and managing them. And just a little bit on our guests before we dive into the conversation. We have Dr. Elizabeth Ortiz. She's a double board certified rheumatologist based in Texas, in Dallas, Texas. She has over 15 years experience practicing rheumatology and has worked in a variety of environments, including academia, public county hospitals, concierge private practice, and digital health. She's a teacher and advocate at heart, and she uses the Connected Rheumatology YouTube channel to bridge the widening gap between doctors and patients by providing trusted and up-to-date information in a practical, easy to understand format. So please check that out. Dr. Andrea Chadwick is medical director of Swing Care, a specialty clinic dedicated exclusively to fibromyalgia. She's double board certified in anesthesiology and pain medicine, and her clinical expertise focuses on complex centralized pain syndromes, including Fibro. She is director of Fibromyalgia and Centralized Pain Exploration Lab at the University of Kansas Medical Center. And Melissa Talwar is the co-founder of the Fibromyalgia National Health Organization, a patient-centered national nonprofit organization dedicated to educating and inspiring the fibromyalgia community. She's also a board-certified functional medicine health coach specializing in group medical care, and she's currently pursuing a nursing degree. So a wide range of experience here. Really excited to have you all here. And I wanted to just start out with kind of the pathophysiology of this, part of fibromyalgia. So like what is happening in the body when we have a fibro flare? Like, do they have like a physical cause? Are they triggered by environmental causes or things happening around us? What does that look like? And maybe Dr. Ortiz, we can start with you.
I don't think we know all the answers. I don't think it's entirely clear from a pathophysiology point of view what's going on. And that's coming from, I'm a rheumatologist by training. So when I think of what I call more traditional autoimmune conditions, like things like rheumatoid arthritis or lupus, we have a much better understanding on the cellular level what's going on and what causes the inflammation. And we're lacking that in fibromyalgia. And so it is difficult to be able to explain what's happening in the body. And so when I'm talking to patients, I still very much use language about how they feel and how they're experiencing the flare. When it comes to what can trigger it, it can be physical and or mental or emotional. It really kind of runs the gamut, which is very similar to the other more traditional autoimmune conditions I take care of. I don't know if anyone has any other perspectives on that.
Yeah, I can chime in just from like a pain processing kind of a standpoint. So what we know about the peripheral and central nervous systems is that it's a delicate interplay between both, and then you add in environmental, psychological, a whole host of other factors that can play a role in how those two systems are interacting and functioning. I always really liken these systems to like kind of like a volume knob on a radio, or think about like an amplifier where a guitar might be plugged into. The amount of amplification, the amount of volume we have of pain is very much dynamic and can change day to day. And so you're right, we don't know the underlying exact like neurophysiologic molecular triggers for this. But what we know is these systems are very in tune with a person's external and internal environments. So as you mentioned, the typical triggers we see that can, for lack of a better words, turn the volume knob up are things like inflammation. And that can be from a variety of different things. It can be from an illness. It could be from something they've eaten that causes more inflammation. It could come from stress, which we know can trigger inflammation as well. And then other factors that could be things like anxiety or stress. that are coming from a more psychological place can play a role as well. So again, it's that delicate interplay of a person's internal and external environments and how it's affecting the peripheral and the central nervous system. And in the case of fibromyalgia, the central nervous system is really thought to be the biggest driver.
And how does that, we talked a little bit about this already, but how does a fibro flare differ from other conditions like an arthritis flare up, recognizing that like some people may have both and maybe trying to distinguish between both?
Yeah, so I mean, I would say from the patient's point of view, one of the most frustrating aspects of, or differences between the two is that the flares of fibromyalgia tend to be more invisible to somebody else who's like the provider that you're talking to versus an arthritis flare. And even arthritis, there's lots of different types of arthritis. We have osteoarthritis, which is more degenerative arthritis. We have rheumatoid and lupus and all my other autoimmune conditions that are more inflammatory arthritis. And when arthritis flares, there's usually some physical signs that we see when you come to see the doctor, you come to see your provider. There's some signs we see on blood work that kind of support the story and the feeling that the person in front of me is describing. What's frustrating about a fibromyalgia flare is there's usually not those corresponding elements. And so it's very much all just the experience of it. And that can make it very challenging to try to explain what the experience is. As far as what can trigger these different type of flares, there are a lot of similarities. The same things that I would talk to my rheumatoid arthritis patients about to keep an eye off as far as diet and stress and sleep that can trigger arthritis flares, those would be the same for someone with fibromyalgia. But when someone has fibromyalgia and only fibromyalgia, I really rely on that person to tell me how they're experiencing their pain because I can't really see it. I don't see it when I do a physical exam. I don't really see it in my blood work, which is different than someone with arthritis.
Yeah, I was just going to add that some of the things that I do when I'm seeing patients, again, their story is the number one thing, is how are you experiencing this? But oftentimes I'll ask if they've had an overall increase in their sensitivities. Many patients have general global hypersensitivities, things like smell, vision. They can have photophobia, phonophobia. Many of them are experiencing hypersensitivity even to light touch. And so those are some things, at least in my office, that I'm able to ascertain outside of like, swollen joints or red joints or blood draw to look for blood inflammation, to be able to kind of see, okay, are we having a lot more sensitivity than typical to their condition? So I think the number one story here is the patient's experience of this is ultimately what matters the most.
Yeah. And just to add to that when you're talking about arthritis flares, even if you're having multiple joints that are involved, most people will still describe their experience as being very limited to the joints. Like it's this wrist, it's that knee, it's this ankle, it's my back, it's the midline of my back. Whereas in fibromyalgia, of course, everyone's different, but it tends to be more global. It's like, and it's tougher to pinpoint exact places. Where when you have an arthritis flare, that's purely an arthritis flare, because as you mentioned, a lot of times there is overlap and you can have arthritis on top of fibro, which really can make it even more challenging to tease out what is what. But arthritis in itself tends to be just a joint.
And, since, the experiential part of it is so important as we're talking about, I'm wondering, maybe Melissa, we can start with you. Like, how does someone know they're in a flare? And that is so personal. And, maybe, some of your clients that you talk with or yourself, like, what does that maybe like, are there things kind of leading up to it? And then when you're in it, I don't know, how do you know?
It took me a while to realize too what that looked like, because to be honest, I had a really bad push crash cycle for the longest time. So I could push myself to go for a certain amount of time because I really wanted to live my life, and then I would crash out. So for my history of like severity, I felt like my flares were really severe and long, but I know everyone's individualized. Sometimes you might have a flare up that lasts a few days. Mine typically in the past were about 2 weeks to months long, that I felt that the pain had really gotten severe. The fatigue was very severe to the point I was homebound or bedbound a lot of the times. So I really didn't at first track all of that, but I had to learn there was a lot and it was complex that I kind of had to search for patterns. So as I learned to track and write things down, I kind of noticed what it was, and I did divide. So a lot of it's pain, but my fatigue was really pronounced, and I had to figure that out, which was really complicated on the energy side. So there were things that might trigger the pain more. So how to prevent that earlier on, notice that in long spurts. And sometimes it took like a 48-hour stretch. It's not necessarily something I was doing the day before that led me to that flare. Was this buildup. If I was doing the 30 minutes of exercise that everybody told me at the gym for 2 weeks, I would probably crash out for 2 weeks. So noticing these patterns, hormonal patterns came up, energy patterns. A lot of that I had to try to figure out and try to take notes as much as I could. And that was actually really helpful for me to learn patterns as I moved through and understanding flares.
Awesome. Yeah, I would just say that I've seen a lot of patients with similar story. And what you said about how it's not always immediate, like, oh, there's a stress and the next day there's a flare. It doesn't always happen. In fact, it mostly doesn't happen that way. And sometimes when I'm, as the objective person, trying to help tie the patterns together and help the person kind of see what's going on, and I'll be asking, well, what's been going on in your life? What kind of stressors? And I always encourage people to think beyond just last week. And let's think, how has your last month been, the last 6 months? Because sometimes, these stressors, we get used to them. We don't think of them as stressors because they're just our everyday life. And so it can take time to figure out what it is that could be driving some of the symptoms.
And we've talked about some of those kind of more common triggers, maybe like stress, sleep. Are there any kind of surprising triggers that you've seen, in your patient populations or your own experience, Melissa? And yeah, it sounds like being able to kind of look out for those as people are tracking might give them some clues to their own kind of personal triggers.
Well, trying to manage my energy was huge. I didn't realize too, and I still have this, and I still have to work through this even in school, was the critical thinking component where I had a lot of brain work. I don't match up with physical work. So I won't be running to the grocery the same day I'm going to take a math test because my brain will cop out. You're asking me about math. So I have to do that when I'm focused, the best time of the day, when I have the most energy, that my brain can kind of think through things. That was a challenge to figure it out. It took me a while, and you might put things together when you're feeling better on those days, but I really have to separate. So I won't be cleaning the house and then taking a math test. I really hone in on the critical thinking. The other challenging one for me to figure out in the patterns was what I mentioned with hormones. So cycles every single time of the month, histamine reactions that would come up, and these would be major flares. And it was really difficult to piece that out in my life. But they were very important with my pain reaction and my fatigue reaction. So it wasn't just necessarily what we normally talk about. There was a lot of complexity to what was going on. But the big piece for me was really energy integration, how to manage my schedule when it came to piecing things out of actually getting stuff done. Because I've always been passionate about projects, trying to figure out how to work. There's things that you have to get done. You just have to do laundry. You need to take a shower. So what does that look like on a scale to figure out my schedule in sort of integrating these ideas and looking out for stuff that may come up?
I was just going to quip in, I've been taking care of patients with fibro for over a decade now. And honestly, I haven't ever been surprised by a trigger because each person's experience of their life is so different, like you mentioned. But I will say, learning about, I think in medicine, it's always like that physical, at least when I was training, it's like the physical stress would be the thing that would bring on fatigue or increase pain for patients. But you bringing up that psychological load, that psychological fatigue, I have a lot of patients who are, juggling being mothers and wives and having careers, and they call it that allostatic load of life, learning that just even that psychological piece can be as taxing, if potentially not more taxing than the physical. I think for me, that was a really surprising piece of all of this. And so I definitely, when I'm counseling patients about, how they should manage and flow through flares, it's definitely giving them that space to just like decompress their brain is so important, especially if there's someone who's juggling a lot of complex tasks on a regular basis.
Yeah, no, I would agree with everything everyone has said. I would say one thing I've learned kind of on the job to start asking, and because it can be an important piece, whether or not this is alone a trigger for fibro, I don't know about that, but it can definitely contribute, which is dehydration. And I think that it's, these things don't tend to happen in isolation. If you are stressed and carrying a lot, both mentally and physically, then you tend not to be taking care of yourself, even in the most basic ways, like drinking water. And so it's like a small thing that you can say, well, let's focus on this. And then that can then hopefully lead to other bigger changes.
Well, and you brought up a good point too, with just these things that we kind of miss. And similar, and this is what I learned with behavior change, is those small changes for behavioral health that I had to integrate on a daily basis to sort of be preventative of the flare. Because when I first heard of like flare kits, I thought this was something that you kind of bring along to just in case, like the emergency happens, this is what you put together. But I learned along the way that it was some of those tools had to just come and be sustainable throughout my life. So staying hydrated, how do you stay hydrated just on a daily basis? Normal part of health. Doing breathing exercises, even though I might not notice that change right away, which I don't, I struggle with stress and the nervous system, but taking that moment, the first thing when you wake up, do some breathing exercises, lean into whatever works for you with breath work, meditation, visual, prayer, but starting to do that just on a daily basis for anything, no matter what, has really helped. And it's also helped in the moments where you can't avoid stress. There's a lot of stuff that comes up in your life, and those moments you build off of those healthy habits that you've already worked on. So I think that's a big thing. And hydration, all of that, nutrition was a game changer there. Sleep. So those non-negotiables, just keeping those in, especially in stressful moments. Just doing that, because sometimes we're just in those moments we can't avoid, like natural disasters, anything like that, stuff with the family. So it's important to keep those handy.
Yeah, that's such a great point. And that's kind of where I wanted to go next is, in past webinars, we've talked about, you can have kind of tips for when you're in a flare, but kind of the best kind of flare management is the stuff you do, all the time, or kind of planning for a flare before it comes up. And so some of those things we talked about, and just like healthy habits in general, are great for that. Do you have any other tips for kind of setting people up to kind of better address flares in advance? Either that's kind of energy management, like you said, Melissa, or other kind of regular parts of their routine that can kind of help decrease the chance of those triggers kind of coming up.
For me, again, it's just a completing. So I always saw stuff, and it was hard for me to understand at first with the idea of pacing and budgets, because I was really bad. I was pushing, crashing over again. So what helped me a lot too was just figuring out that side of it, like what were the triggers, but then also what could I do to replenish the energy or keep refilling. So you got to refill the tank, but I always felt like I was running on empty. So then I couldn't do anything on an empty tank. So I really had to figure out both sides to what were things that were going to help me refill that energy. And like I mentioned, it may have to be daily, it might be weekly, and figuring out those points that I was able to do. And time blocking was something that I discovered that really helped with my schedule, because if I say I have like 10 minutes or even an hour where I could think straight, what could I slide in that slot? And then have some flexibility throughout the week of adjusting, seeing how I'm doing, because sleep has always been notoriously hard for me. So that will change the game of the day depending on how well I sleep. But knowing that stuff, so just taking things like nutrition, sleep, what could I do to improve those variables throughout the week? And it's hard because I broke things down to a micro level. And this is kind of what I work with people on, just picking a goal that sounds good to you, which you notice may make the most impact, or you've seen make an impact, and kind of look at what will help enhance that. So sleep hygiene, I do everything, shut down those devices, turn my phone on airplane mode, nobody's reaching me. So all kinds of stuff like that. And there's a lot, and the good thing is there's a lot of things that people can work on to help with managing those flares.
I'd also say, kind of along the same lines, is when we think about events or things on our calendar that might be stressful, sometimes we don't think about things that are fun and exciting, and like vacations and weddings, because we don't align stress with like fun, even though it still can be just as much of a stressor to the body. And so just planning ahead and giving yourself some rest and like blocking your time to make sure that you can recover even from the fun and the excitement, whether it's vacation and you're traveling multiple time zones and sleep gets all off, or again, like I see it a lot with weddings. It's like, well, I was excited about my wedding and then I crash. I'm like, well, you need some time to recover.
Yeah, that's awesome recommendations. I always, for the vacation thing, I always tell my patients to like schedule like gap days if they can. You know, I recognize that certain people's time off and whatnot may not align with this, but trying to at least take a day before, maybe a day or two after, to be able to like prepare for your trip, both mentally and physically, be on your trip, have your tips and tricks while you're there. But then that re-entry is so important, whether it's the time zone changes, or I don't know, for me, it's like I have 2 children who make like insane amounts of laundry. And like, if I can't get home and be able to like unpack and do the laundry and do my grocery shopping, like I will re-enter work like completely unrefreshed. It's both a physical and a psychological load thing, but I really like that idea of, you know, making sure that even with the fun things, you're not allowing for that stress of the fun thing to impact you. And another thing I wanted to bring up was, you know, just that, like that idea of scheduling those things throughout your day. There's a variety of different apps that I recommend for patients. I won't promote a specific one here, but there are apps that allow patients to put in their self-care goals of the day. And it could be things, very simple things, from like brushing your teeth and washing your face to, you know, stepping outside once, or going for a short walk, or I'm a big believer in like the gratitude parts of the day. I think we oftentimes are so focused on like the things of our day that are weighing us down, but like those simple things, just looking in the mirror and saying like, thank you for supporting me today. But those are all very important. So I recommend those self-care apps to patients so that they can prioritize themselves. I think a lot of times in this world, we deprioritize ourselves for the people around us. And just reminding my patients that, you know, no is a complete sentence as well.
Well, you can have so much fun too in your day with planning, because I love playing with my dog. So my dog will get me moving. I'll act like the dog. So it's just about play when you have movement too, and just adding those aspects. Or, you know, you're petting the dog. It's good. They're just pets, cats, whoever's your pet is just integrating that. And I love the planning for rest, even on vacations, because I think too, sometimes vacations, well, I know I have a family member that plans every single thing out. So I won't be able to necessarily travel with him because I need to, or not go to all the places, because after a long flight or even a short flight, like I'm like, I'm here, I'm resting, I gotta chill and take time for that, instead of the go vacations where you're always on the move. So it's being okay to just be able to plan that in. Even if you get time with the morning, like I've tried to really just make sure that my schedule for sleep stays in place as much as possible. There might be some wiggle room, but I get thrown off a lot if I change that, even on vacations or things like that. So I just maintain that. I might wake up a little bit earlier than other people in my group, but it's okay, because that's where I'll just enjoy my breakfast, do some breathing exercises, keep up with my routine. So.
Yeah, and I would just add, it's very easy when we start talking about how to best take care of yourself to try to prevent flares, even though, you're still going to have bad days. But it's very easy to get bogged down with like, well, you need to be sleeping perfectly, you need to be eating perfectly, you need to be, doing all these things perfectly. And just to also acknowledge that you're never going to be perfect and that it's okay that you're going to have better days. And we live in the real world. We have responsibilities, we have things to do. And sometimes that gets in the way. And the other thing I oftentimes will notice that we forget is when you're trying to plan out and all the different, components of a balanced, healthy life is connection. And like what you were mentioning with your dog, like, connection with friends, with family, with animals, with nature, like, as maybe just my algorithm, but I feel like the internet's like everywhere you turn, it's like we're in a loneliness epidemic, and that can certainly impact how your nervous system responds to stress as well. And so I don't want to add another thing we need to be perfect at, but just to be, you have all these things that are important when thinking about how to best take care of that nervous system.
I love that we're kind of talking about a lot of the kind of baseline and how we can kind of improve that baseline. But realistically, there are going to be days where a flare is happening. For me, it's like I have migraine and I just like can feel that little like pulse, and that's just like your migraine is coming. Like when we have those kind of signals that we, feel a symptom flare is happening, are there any techniques you recommend, practices you recommend? And I recognize, everyone's going to be a little bit different, but in your experience or with your patients, how have you seen things be effective?
I mean, I love that we're kind of switching gears, because I do think we live in this society of like perfection and social media and like always putting your best self forward. And so like my number one kind of trope to my patients is like, give yourself some grace. Give yourself some grace and make sure the other people around you are giving yourself grace. I love that we've been talking about connection and family and friends, and I think that support network during these times is extremely incredibly important to patients, whether it's having family members that they can lean on to help out with certain tasks if they're needing to get rest, making sure that their spouse or partner is supportive during these times to maybe take up a little bit of extra slack around the home or with tasks. And also even at work and with your family, there can be a lot of dismissive people out there. And so doing your best to really explain like, no, I'm not doing this to annoy you. Like this is like, I need your support so that I can get through this much more quickly. So I think it's that great. And then just like we've talked about the whole entire time, like when it comes to flares, I think the things that cause them are very, different per person. And I think the things that help each patient are different per person, mainly because, what might be soothing and relaxing to someone might be stressful to another, right? There might be someone who's, scared of dogs, so they don't want to be around dogs when they're having a flare. And so I always just ask patients, like, what are those things that help you feel like you're not in the fight or flight anymore? Does listening to music, a certain type of music, help you get to that place? Does shutting yourself in a dark room and putting on, just some ambient like white noise help you get your nervous system calmed down? For some patients, it's taking like a hot bath or a hot shower to really kind of ease those muscles. And so similarly to what Melissa mentioned, it's like having that data of like, keeping good notes and knowing what helps is important. And then above and beyond that, if all else fails, working with your healthcare provider to maybe find something that might help in addition to all the non-pharmacologic options.
Yeah, no, I agree with all of that. It is very personal and it can take time. It can take time to figure out what your tell is, like you were mentioning with your headaches. And then it can take time to figure out, well, what intervention is going to serve you best at what point. And so to me, like the one kind of general thing I can say is exactly what Dr. Chadwick was saying, is to give yourself some grace. Don't panic. I see a lot of anxiety just around the flare itself, which can then kind of make things even worse. And to not blame yourself. This isn't your fault that it happened. You know, flares happened. I think of that what's that movie? Forrest Gump with the, you know, with the bumper sticker. And I'm like, well, flares happen and it's nobody's fault. And even in the moment of the flare, I see people immediately try to jump to the investigatory work of like, why did this happen? And then that can just add to the mental stress. It's like, let's do that later. We can figure that out later. We can like dissect and figure out maybe how we ended up here. But right now, let's just focus on caring for your mind, caring for your body, giving your body the rest it's clearly asking for. And we'll worry about all that stuff later.
Yeah, all those tools are important, and just noticing to give yourself rest, take the time to rest. One of the big things I had to learn too was, as we talked about, communicating with other people, because people don't know that you're maybe in a flare or getting worse. So I had to really figure out how to communicate with my partner, making sure he knew, and he likes to be helpful. So what can he do? What can he do to help? Like, what do you need? So just understanding that, having those conversations outside of it when I'm not in a flare, what does that look like? Having things planned in advance. So if there are groceries that need to be, he knows what to do. I have pictures for him to go off of, and if they're not at the store, don't buy it, because I'm very specific on what I need. So just making these patterns in advance when you're not in a flare, and then communicating to him what you need, what you're looking for. I may not need his help, but I'll let him know, and being honest about it, because I am that type of person that if you're in a dark room, nothing, just go. I'm also introverted too. So if I have had a day where I'm talking to a lot of people, I need to go to a dark room and just sit in quiet. So it's noticing all of those things in advance. And then again, if I'm in a flare, I'm going to just have to rest. The hardest thing for me was to calm my mind, and showing a lot of self-compassion. So kindness talks, affirmations, doing breath work while I'm there to just calm that nervous system, trying to tell myself, remind myself, I'll be able to do this again. This is just, you know, the moments, and really just kind of take my time to rest and recover and communicate what I need to other people around me.
Yeah, I love that, self-talk as well as that, communication with your support system. I know in past webinars, I think someone's mentioned, yeah, just like kind of having a code word with your support system, or you're just like, okay, when I say this is what I need. And it might just be, I need to like be alone. For me, it's like I listen to rom-coms, not looking at them in a dark room. I just listen to them. And that works. I wanted to talk about something you said, Dr. Ortiz, about kind of that anxiety around the flare itself and how that kind of creates that cycle. And, sometimes we see it, even if a flare is not starting, just, that concern that it's going to happen if I do X, Y, Z. Do you have any recommendations for getting out of that cycle, or kind of calming those thoughts? Because, yeah, they can be so intrusive.
Yeah, nothing that's quick. Not like no quick fix here, unfortunately. I think it takes, from my experience, the people who are able to kind of calm that anxiety, and it's not kind of like, oh, I've calmed it, I've mastered it, and it never comes up. I mean, it will still kind of rear its head, but there's an element of trust that needs to be rebuilt when you have fibromyalgia, because it can definitely feel, at least what I've noticed in patients, it feels like a betrayal of the body. You don't understand your body anymore, and because you don't understand it, you are almost like walking on eggshells around your own body. You don't understand, and you're worried anything will make you flare, and maybe this will be the flare that never goes away, and that can just really build. And so kind of going through flares, like the flare, and then coming out of it, and then doing it again, and like building that trust that this is not permanent, that this is temporary, and that you can manage it. And that also part of that is building your team, that you have a team of people that can help you through that, both professionals and providers, but also friends and family. And this takes time. It takes time to build that. So yeah, nothing quick, like no mantra, unfortunately, that I've seen work for everyone that's going to like make it go away.
You're absolutely right. And I think, you know, that journey is just part of the process. And I always tell patients to embrace all parts of their fibromyalgia journey, even the hard ones, because ultimately I think embracing that and walking through it and doing the hard work to get to those points is worth their time.
I would also just add, as part of that journey is letting go of the compare and despair that we tend to do. I think a lot of the thinking of like, well, I want to like I need to be doing more. I like, why am I not more productive? Why can't I do not even what I used to do, but what I feel like others can do. And you just have to like let that go, because first of all, you don't know what they're going through. You have no idea what other people's lives are. And you're not living their life. You're living, like, this is your life. This is your body. We have to learn how to take care of it and live your life to the fullest within what your body can do. But that's hard. I mean, it's hard to do for all of us to not compare ourselves to what we see out there. And of course, social media has made it even worse.
I know we're kind of reaching the end of our time here. I did want to come back to something you said, Dr. Chadwick, around, you know, the conversation you have with your provider, and, you know, medication can be a part of people's fibromyalgia treatment as well. And are there ways you think about, you know, as a clinician, prescribing, you know, for flare days versus other days? How do you kind of think about that in your recommendations to your patients?
Yeah, I mean, ultimately, I think it's that shared decision making with the patient and what their, you know, needs are during flares. I think for some people, it's easy enough to get rest and maybe alter their diet a little bit. Perhaps it's certain types of, you know, movements, or like I said, warm baths or hot baths that get them through. But for some patients, you know, they do all of those things and it's still not good enough. And those are the instances where I'll talk with patients first about like over the counter types of therapies that they could try, whether it be, oftentimes I recommend like magnesium during those times to help get through flares, because it can help with muscles and nerves and with sleep. And then above and beyond that, there are certain what I call PRN or as needed medications that patients can take, and obviously taking into account their medical conditions. Typically speaking, if inflammation is not part of this, things like NSAIDs aren't going to be particularly helpful, but certainly they could be trialed as a first line. And then above and beyond that, if patients have like significant amounts of muscle spasms, occasionally I'll prescribe like a skeletal muscle relaxant just to take as needed for flares only, to help them try and calm their muscles, calm their nerves, maybe potentially even for the sleep effect of those types of medications as well. But we obviously don't want to be over reliant on medications to manage flares. And so for a lot of patients, I say, well, these are kind of like Band-Aids, little temporary fixes that might at least help you get some sleep. But ultimately, it's those lifestyle modifications, those non-pharmacologic interventions that are going to be most important in the long term.
Yeah, I always say there's like, if prescriptions need to be discussed, we can certainly discuss them, but they will not take away the recommendation to do all the other and to rest and let yourself do all these other practices that will calm down the nervous system.
And just to kind of end a little bit about where we started when you were talking about, how do we describe a flare? How do we, know when we're in one? When people are talking with their clinician about flares, how can they kind of talk about that more productively? Because I know people have had, really hard challenges in those, medical visits where they're talking about their experience, they're not being listened to. And is there anything that you found that really helps you kind of home in on what a patient is going through, or Melissa, from your perspective as well, helped with those kind of more productive sessions with your clinician?
Well, I mean, I can say as the clinician that it's very helpful for me to really kind of get a full picture, to understand how their symptoms, whether it's pain or brain fog or whatever it is that they're experiencing, how it's impacting their daily life. So giving me examples of like, well, I usually can do XYZ, but for the past 2 days, I haven't been able to do XYZ. I can only do this, section of it. Or I'm, haven't been able to cook dinner for my family, or whatever it is, like giving like tangible examples within daily life of what they are not able to do. For the exact reason that you stated, is that not every provider has the experience with fibromyalgia, understands, if you just use the word pain, that's actually a very subjective word. And even the doctor you're talking to might hear it differently than the way you're trying to explain it. So when you say you're giving concrete examples in your life, that can help paint a clearer picture to the person who you're trying to communicate it with.
Yeah, and oftentimes I would say, just to add on to that, because that whole picture is so important, kind of when the patient is in it, it's oftentimes very hard for them to they can talk about the pain. They might be able to talk about how it's been impacting them, at least in the short term. But I oftentimes like to even go a bit bigger, like what's going on in your life right now? Like if you had an injury, at least here in Kansas City, our weather is bananas. And so oftentimes I see a lot, and I should have answered this earlier when you were saying like, what weird things have you heard of with triggers? I mean, the weather is definitely a barometer for my patients when it comes to flares. And so I'll ask about all of these other things that they may not be focused on because they're so focused on the pain, and they can't step outside to see, oh yeah, like my son's getting ready to graduate and I had no idea that all of these other things that I've been managing were going to be so stressful. Or have they been sick recently? I've had patients who've gotten a surgery and not realized that the surgery may cause them to have a fibromyalgia flare. And so even that bigger picture is important to kind of ascertain, because a lot of times it lets me know, like, okay, here's what's going on in your life, and how can we mitigate some of these other things, although I can't change the weather. Wish I could.
I would even add, like, taking even a step back, is finding your team and finding the provider that you're on the same page with. I mean, even baseline that, like, yes, there is fibromyalgia that's happening. Yes, like that you both have that agreement and understanding, and that you're not, every time you're going in to talk about your flare, you're not having to like kind of reinvent the wheel and like yet again convince them that you've got your team of providers that understand what you're going through.
And I'm going to even piggyback on that. I love this pink, like we're having an awesome discussion here. So often I see patients who are having a flare of pain being attributed to their fibromyalgia when they're actually presenting to me with like something that I think is completely not fibromyalgia, because it's not presenting as their usual pain, just in an elevated way or with the fatigue and whatnot. And so I've had patients, to me, fibromyalgia is a yes and condition. We can't forget that even if the pain is flaring, if it's something new or different that you haven't experienced before, that needs to be run by a provider, and having that trusted team who's not just going to shove it into the, oh, it's just your fibromyalgia, bin, just rest or exercise and you'll be fine, is really important, because I have quite a few patients who had missed diagnoses when they've been having what they thought was just a pain flare, but when they told me, oh, it's different,
yeah,
then we were able to kind of work up that problem.
Yeah, no, that's a great point. I mean, one of the guys I trained with long time ago was his kind of pet or like little niche area was fibromyalgia, and he used to always tell us, like, fibro patients also get heart attacks, they also get pneumonias, like they also get all the other things. And you're exactly right that with your there's a lot of ways it can go wrong. And one of them is just assuming all the pain is from fibro and you just need to sleep it off, kind of thing.
Well, speaking of a trusted team, thank you all so much for being here. This was such a great group for this discussion. And also just a reminder to folks that we'll mention where people can find you, but you can send this to your clinician if they're interested. We have a lot of resources that aren't just for patients. You know, a lot of folks find them helpful to share with their support team, either it's a provider or their loved ones, just to be able to talk about this a little bit more. So, Dr. Ortiz, maybe we can start with you. Where can people find you? And then we'll wrap up.
Yeah, I would say this has been great. And the best place to find me is on YouTube. My YouTube channel is Connected Rheumatology. So yeah, that's where I'm at.
And Dr. Chadwick?
Well, you can find me on our Swing Care webinars and other webinars that I've done on YouTube, both with Swing Care and others. And also I'm at the University of Kansas.
And Melissa?
Well, I probably spend too much time on social media, so just look for at Fibromyalgia National. And then you can find me with my last whole name, Melissa Talwar. So I'm on Facebook, LinkedIn.
Great. And I'm Nicole at Swing Care. Again, you can find us at swing.care for more webinars like this and for more resources on fibromyalgia care. But really appreciate all of your time today. Thank you so much, and really looking forward to the next one.